Documentation, tracker sheet, observation of vulnerability points of patient at every ward, identification of patient having pressure injury. Documentation integrated and include staging, prevention measures taken, record of comorbidity and nutritional status. Tracker sheet, review record, follow-up tracing, daily checking of staging, parameters like discharge, slough, sign of inflammation, bleeding, photography, twice a week, and outcome depends on age of patient, constitutional status of the individual, severity of the primary illness, compromising movement in bed, particularly sepsis, fracture of pelvic bone, obtunded state, associated comorbidity, namely diabetes, hypothyroidism, collagen tissue disorder, blood dyscrasia, stage of PI, size, depth, along with any superadded infection. Outcome measure, documented incidence of individual having pressure injury, healed, time length required for healing, change of size of pressure injury, cost incurred due to presence of pressure injury, quality of life, and after healing, any recurrence of pressure injury. And scale for monitoring pressure injury, post scale pressure ulcer scale for healing, fast and accurate tool designed by NPIAP and validated repeatedly at least weekly assessment of these three parameters: wound size, greatest length into greatest breadth, exudate amount, light, moderate, heavy, tissue type, epithelial, granulation, slough, necrotic, HR. Weekly assessment of three parameters to explore wound status: pressure source status stool, pressure source status tool, assess 15 times of characteristics of wound, adjoining area, 5-point Likert scale. Total score is documented periodically to monitor changes of wound pattern over time. Disadvantage of this assessment: use of large number of data which cannot be consistently documented. Assessing scale: simple, easy to use observational scale where verbal description of granulation, tissue infection, drainage, necrosis, and HR are documented for examining progression or recession of PI wound. Photographic wound assessment tool, that is PWAT scale, photographic wound assessment tool, multiple photograph with different cameras, assessment done by both clinician as well as non-clinician, photographic views. Incontinence associated dermatitis, perineal dermatitis, inflammation, breakdown of patient skin associated with prolonged exposure to urine, stool, especially in case of bowel bladder incontinence, when managed by absorptive sheets. Transepidermal water loss, rate of water diffusion from internal environment to the external environment. Transepidermal water loss, particularly true for